drawing, you have to keep in mind, it's a practicing figure, and you see this, the head and neck receive major blood vessel supply from carotid arteries, common internal and external carotid arteries, subclavian arteries. Now the head and neck receive major blood vessel supply from carotid arteries, common internal and external carotid arteries, and subclavian arteries. Now this is the internal carotid artery, this is the external carotid artery, this is the right common carotid artery, the right subclavian artery. It arises from the brachiocephalic trunk, and this is the arch of the aorta. When you are reading the organ heart, then you will be having a specimen with all this up to this level, the arteries, and this is the right common carotid artery, the right subclavian artery, and this arises from the brachiocephalic trunk, whereas the left subclavian artery and left common carotid artery rises from the arch of the aorta. So you might be asked a question, it can be an MCQ, or the difference between the right and left. This is important. Now, subclavian artery, the right and left subclavian artery supply mainly the upper limb and partly to the neck and brain. As it passes deep to the clavicle, it is called subclavian. It is passing to the under the clavicle. So, and even in OSPE, you will be given to identify the subclavian artery. So, it's very important. Now, the right and left subclavian arteries supply mainly the upper limb and partly to the neck and brain. As it passes deep to the clavicle, it is called subclavian. Beginning right subclavian artery, it arises from the brachiocephalic trunk. This is the brachiocephalic trunk. Behind the right sternoclavicular joint, left subclavian artery, it arises from the arch of the aorta. The left subclavian artery rising from the arch of the aorta and ascends up to the left sternoclavicular joint in the superior mediastinum. Of course, the subclavian artery undergoes its course with an upward convexity. It extends from the sternoclavicular joint to the outer border of the first rib. Yeah. Now, individually, you have to read the subclavian artery. Now, this is the flow chart. Now, this is the termination. The termination, the subclavian artery continues as the axillary artery of the outer border of the first rib. This, the axillary artery, and outer border of the first rib, this first rib, this axillary artery continues as the axillary artery. Now, the subclavian artery is divided into three parts by anterior crossing sclera anterior and muscle as follows. First part, it extends from the beginning of the medial border of the sclera anterior. This is the medial border of the sclera anterior muscle. Second part, it lies behind the sclera anterior muscle. Third part, it extends from the lateral border of the sclera anterior muscle to the outer border of the first rib. If you are given a rib, the teacher will ask you, the examiner will ask you the root of subclavian artery. And the important landmark is the scleras muscle. Now, the second part, it lies behind the sclera anterior. Third part, it extends from the lateral border of the sclera anterior to the outer border of the first rib. Now, relations. Now, you have to read all this, that is skin, superficial fascia, and platysma, sternocleidomastoid muscles, scleromastoid muscles with the investing layer of deep cervical fascia, anterior jugular vein, sternohyoid, sternothyroid, infrahyoid muscles, common carotid artery, internal jugular vein, vagus nerve, vertebral vein. Posteriorly, the suprapleural membrane, cervical pleura, apex of the lung. Relations of the second part, anteriorly skin, superficial fascia and plasma, sternocleidomastoid with the investing layer of deep cervical fascia, subclavian vein, phrenic nerve only on the right side. Now this is important. Phrenic nerve on the right side, sclerus anterior muscle, posteriorly suprapleural membrane, cervical pleura, apex of the lung, lower trunk of the brachial plexus, sclerus medius muscle. Now this, as you see the whole chart, it is long, it's long. But if you, the neck, the whole thing, your neck, if you see, is that right and left doesn't differ. So whatever you are seeing on the right side, left side, with little bit of differences are there, you can easily enlist the right side and the left side. Now you have to just again relations of the first part. These are the vagus nerve, skin, superficial fascia, plasma, sternocleidomastoid muscle. See, right sternocleidomastoid, left sternocleidomastoid. Plasma muscle is common to both sides. You don't think it, don't get panicky. You have to just, right side, you have to mark. You just mark one side and only the difference you have to note. And now, the sternothyroid muscle, common carotid artery, internal jugular vein, vagus nerve, vertebral vein. Now, posteriorly suprapleural membrane, cervical pleura, apex of the lung. There are two lungs, then the apex of the lung is related, and also the cervical pleura and apex of the lung, suprapleural membrane. Relations of the second part, again similar, skin, superficial fascia and plasma, sternocleidomastoid with investing layer of cervical fascia, subclavian vein, phrenic nerve, only one right side. On the right side is the phrenic nerve, it's a repetition. Now, and the sclerus and anterior muscle. Now, you please, when you are seeing the prosected specimen in the dissection hall, you please correlate your dissecting manual with a atlas and also the specimen on the table. The dead body specimen you must observe and see. You all are neglecting this part. I went to the dissection, mortuary yesterday and to bring a specimen. Before that I told you I am bringing a specimen, but you all left except few students stayed back. Don't do this because you are, now you will have to go for an examination, final exam. You have to know the technique of reading. From day one I am telling you. But yesterday I praised you for your taking some patience because I was late 15 minutes. But after that, only few stayed back. If I would have been 10 minutes late, all would have left this demo room. Don't do this, don't do this. আমি বলবো না ভেবেছিলাম কিন্তু আমার যেন না বললেই নয় আর কি। Now relations of the third part, it lies in the supraclavicular triangle, anterior middle 1/3 of the clavicle, subclavian vein, external jugular vein, transverse cervical and suprascapular artery, vessels and anterior jugular vein, posterior suprapleural membrane, cervical pleura, apex of the lung, lower trunk of the brachial plexus, sclerus medius, superior, upper and middle trunks of brachial plexus, inferior first rib. So you can just draw the diagram, just level, and you see, have an atlas in front of you. If you have formalin allergy, it's a different issue. But 150 students cannot have formalin allergy. তুমি right upper limb পড়বে, the same thing you will need in left. Similarly, head and neck, you cannot isolate it because there will be a major part from head and neck, equally distributed. All the parts are equally distributed. Now you see, this is the plane of section. This is the plane of section that is drawn. You can see. Now what you will see, you see the Yogesh from Jipmar. He is a brilliant teacher. He is saying the practice figure, the schematic. See, apex of lung, cervical pleura, suprapleural membrane, scalenus medius, lower trunk of brachial plexus, subclavian artery, scalenus anterior muscle, suprascapular transverse cervical arteries, and your prevertebral fascia, subclavian vein, suprascapular transverse cervical vein, investing layer of deep cervical fascia, platysma muscle, skin. Here, phrenic nerve, ansa subclavia, vagus nerve. This is the vertebral vein. This is the internal jugular vein. This is the common carotid artery, sternothyroid muscle, sternohyoid muscle, and the anterior jugular vein, and sternocleidomastoid muscle. This you make a card and draw yourself, and you practice. Keeping a book in front of you and practice when you are reading. Mane lekha pada, you write, copy. Now, these are the branches of the subclavian artery. You have to read it yourself. This is the branches of the second part, the branches of the first part. Just anyway, vertebral artery, internal thoracic artery, thyrocervical trunk, inferior thyroid artery, transverse cervical artery, suprascapular artery, and costocervical trunk only on the left side, Superior intercostal artery, deep cervical artery. Branches of the second part, costocervical trunk only on the right side. Now this is important. Branches of the second part of the subclavian artery, costocervical trunk only on the right side. Branches from third part, dorsal scapular artery, occasional branch if present, don't think of occasional branch. Dorsal scapular artery, note mnemonic of branches of the first part of the subclavian is vitamin C and D for thyrocervical trunk and sit. Now, see, this is the scapula, this is the glenoid process, this is the acromion process, this is the clavicle. The clavicle is cut open. This is the sternoclavicular joint. This is cut open to show you the relations of the sternus anterior muscle and sternus medius muscle and the transverse cervical artery, suprascapular artery, dorsal scapular artery arising from the aorta, and axillary artery, subclavian artery. Now, this is the thyrocervical trunk which gives rise to the suprascapular artery and the transverse cervical artery. And the vertebral artery is going like this. Now, inferior thyroid artery, this is the inferior thyroid artery, scalenus anterior muscle, scalenus medius muscle. Cut end of clavicle, first costal cartilage, and internal thoracic artery. Now, this will visualize and you can picturize the total content of this. Now again, it's practice figure. branches of the right and left subclavian arteries. Now this is the internal thoracic artery here. Now internal thoracic artery. Now these are the vertebral arteries, and this is the dorsal scapular artery, costocervical trunk, thyrocervical trunk, and scalenus anterior muscle, inferior thyroid artery, transverse cervical artery, suprascapular artery, thyrocervical trunk, and costocervical trunk left, and dorsal scapular artery. The branches of the right and left subclavian artery. Now, this is a figure you must practice. See, Yogesh has put in the practice figure. So it will be there for all textbooks. Now this is important. See, head and neck, and you see, compare the lower limb or upper limb. Practice figure was not in that content. So the importance of it, because it is the supplying the head, neck, brain, and brain is a big content. Now some interesting facts. Now the right subclavian artery develops from three sources: right fourth aortic arch, part of the right dorsal aorta, and the right seventh intersegmental artery. The left subclavian artery develops with left seventh segmental artery. The second part of the subclavian artery lies from 1.5 to 2.5 centimeters above the clavicle. This picture showed this. A pulsation of the subclavian artery. The subclavian artery can be palpated in the supraclavicular triangle by pressing it against the first rib. There, the third part of the subclavian artery lies superficial. So the superficial, the third part of the thing, in the first rib, if you press, you will get the pulsation. Over here, you will get the carotid artery pulsation. Now, ligation of subclavian artery to prevent loss of blood in the upper limb injury or the amputation of the upper limb. The third part of the subclavian artery is ligated in the supraclavicular triangle. Now, if there is a loss of blood in upper limb injury, the severe injury, so instead of clamping and this thing, quickly dissect, open up the and ligation of the subclavian, they prevent the blood loss, injury, the amputation of upper limb. The third part of the subclavian artery may be ligated in the supraclavicular region, because the when it is the beginning. Naturally, if you hold it here and directly from the pumping from the heart, that it gushes. So slowly, you just don't panic. You cannot put a tourniquet. You have to dissect out and catch the hole and then ligate and then proceed. Now, vertebral artery. Now, see, this is the basilar artery. Fourth part of the vertebral artery is here. Foramen magnum, this is the foramen magnum. Third part of the vertebral artery, and transverse process of the atlas. This is C1, C2, C3, C4, C5, C6, C7. 7 cervical vertebra. Now, the interesting fact is that the transverse processes have a foramina. Now, examiners will ask you what passes through this foramina. Then you tell it is the vertebral arteries that go along the foramina. Ports and parts of the vertebral. This can be a question, write a short note of vertebral artery. It is one of the main arteries that supply the brain and spinal cord. Beginning, it arises from the upper surface of the first part of the subclavian artery, and ports, it passes upwards to enter the foramina transversarium of the 6 cervical vertebra and traverses upwards in foramina transverse of upper 6 cervical vertebra. After emerging from the foramina transversarium of the first cervical vertebra, this artery winds backwards around the lateral mass of atlas And further, the artery enters the cranial cavity through the foramen magnum. Through the foramen magnum. In the cranial cavity at the lower border of the pons, it joins with the similar artery of the opposite side of the basilar artery. Yeah. So when you see the base, the brain from the undersurface, so you can see the circle of Willis and the pons and medulla, and you can see and you correlate. You have a atlas or you have a drawing there, and could try to correlate and see how it is. You in this dissection period, you please read over, because you will be going for an exam. Then you have to recover all this. Now the head and neck will be neglected. Now vertebral artery termination. The vertebral arteries join each other in the midline, the cranial cavity, the lower border of the pons to form the basilar artery. Now, part of the vertebral artery based on location in the vertebral artery is divided into 4 parts as follows. First, the cervical part, it extends from the first part of the subclavian artery to the foramen transversarium of C6. Second part, vertebral part, it lies in the foramen transversarium of C6 to C1. Now, C6 to C1, this second part, this is the first part. Now, third part, suboccipital region here. Now, it extends from foramen transversarium C1, vertebral to foramen magnum in the skull. This is foramen magnum in the skull. Now, fourth part, intercranial part, it extends from the foramen magnum to the lower border of the pons. It goes there and then lower border of the pons. Now, some interesting facts. The first part of the vertebral artery is present in the scalenio-vertebral triangle. The loop of the third part of the vertebral artery dampens down an arterial pulsation within the cranial cavity. The third part of the vertebral artery lies within the suboccipital triangle. Remove the semispinalis capitis to visualize the third part of the vertebral artery in the suboccipital triangle. Here it lies over the posterior atlanto-occipital membrane. This is a revision. Now, some interesting facts. The spinal branches of second cervical vertebral artery enter the vertebral canal through the intervertebral foramina and supply the cervical part of the spinal cord and meninges. Muscular branches arises from the third suboccipital part of the vertebral artery, supply the muscles around the suboccipital triangle. Intercranial branches are described on the 6th volume. Now, development of vertebral artery. The first part extends from the subclavian artery to the foramen transversarium. 6 cervical vertebra develops from the dorsal division of 7 cervical intersegment. And second part extends foramina transversarium from 6 to 7. First cervical vertebra develops from postcostal and apical. And third part extends from the foramina transversarium and rests on the posterior arch of the atlas. Develops from spinal branch of the cervical intersegmental artery. Fourth part, intercranial part, develops from this neural division of the spinal branch of the basilar. I think this is not so. Now, this is important. Now, clinical integration. Now, subclavian steal syndrome. Now, subclavian steal syndrome, the obstruction of the subclavian artery proximal before the origin of the vertebral artery results in this syndrome. In this case, the blood from the brain enters the vertebral artery and then to the subclavian artery distal to the obstruction. Results ischemia, neurological symptoms. See, this is a thrombus block in the left subclavian artery. Then it goes like this. So there is obstruction, naturally blood flows in this way. With the basilar artery, the right vertebral artery, left vertebral artery. Now, right subclavian artery, left blocked by thrombus. Now, internal thoracic artery. It is also called internal mammary artery. Beginning, it rises from the inferior surface of the first part of the subclavian artery, opposite the origin of thyrocervical trunk. Now, from this region, it goes an intersegment of this. This you read in thorax, and this is the muscle, this is the intercostal spaces, this blood vessel. That is the posterior view of the anterior thoracic valve. Artery has between costal cartilages and sternocostal muscle. This. Thyrocervical trunk is a short wide branch of subclavian artery. Bringing it rises from the superior surface of the first part of the subclavian artery along the medial margin of the sphenoid anterior muscle. Termination, it divides into three branches: inferior thyroid, superficial cervical, and suprascapular arteries. Inferior thyroid branches: inferior thyroid artery, ascending cervical artery, inferior laryngeal artery, tracheal, esophageal, and pharyngeal branches. Transverse cervical artery divides into superficial and deep cervical branches. Suprascapular artery. See, this is the vertebral artery, costocervical trunk, and this is subclavian artery, thyrocervical trunk, and internal thoracic artery, the cervical apex of lung, and see the second rib, break of the first rib, and see the transverse process of the seventh cervical artery. Now, costocervical trunk, it arises from the posterior aspect of the subclavian artery as follows. On the left side, from the first part of the subclavian artery. On the right side, from the second part of the subclavian artery. Course, the artery passes backwards above the cupula of the pleura. Termination, it divides into two terminal branches: deep cervical and superior intercostal artery at the level of the neck first rib. Branches: deep cervical artery, superior highest intercostal artery gives first two posterior intercostal arteries. The same picture in deep cervical artery, superior intercostal artery, dorsal scapular artery. Now, compression of the subclavian artery, clinical integration. Compression of the subclavian artery, third part of the subclavian artery may be compressed against the first rib after depressing the shoulder to present the blood loss from upper limb. Now, depressing the shoulder, you just like this. You put it, not like this. So, you palpate and then you compress. Then you see the pulsation, because there's an injury. It can be in the forearm, or it can be in the cubital fossa. It can be in the arm. So accordingly, you will try to palpate and pulsation and see that how it is. Now you can block that. Now the cervical rib may compress the subclavian artery. Critical finding: Adson's test. In this case, when the patient turns the chin upwards and to the affected side, a radial pulse diminishes or deep to inspiration. So, if it is in the affected side, then there will be diminished pulsation. Okay, that is known as Addison's test. Aneurysm of the subclavian artery occurs mostly in the third part of the artery. It may compress the trunk of the brachial plexus, which leads weakness, numbness in the upper lip. Now, in the aneurysm in the axilla, then patient will come with a complaint of numbness, weakness, and the upper lip. Common carotid artery. The right and left common carotid arteries are the chief arteries of the head and neck. This is the chief artery. The common carotid artery is the chief artery of the head and neck. Now, beginning, right common carotid artery arises from the brachiocephalic artery behind the right sternoclavicular joint. Left common carotid artery arises from the arch of the aorta in the thoracic cavity. It ascends towards the left sternoclavicular joint in the neck. Ports are in the neck. Both the CC, common carotid artery in the neck, have a similar course. Each artery runs upwards from sternoclavicular joint to the upper border of the lamina of the thyroid cartilage. That is up to the level of intervertebral disc between C3 and C4 vertebra. At this level, it terminates by dividing into external and internal carotid artery. Termination, common carotid artery divides into external carotid artery and internal carotid artery at the level of upper of the lamina of thyroid cartilage and the level of intervertebral disc between C3 and C4. Relation, common carotid artery lies with the carotid sheath medial to the internal jugular vein. This vagus nerve lies posteriorly in between internal jugular vein and common carotid artery. The common carotid artery is overlapped by sternocleidomastoid. Now, these specimens are there. You ask for the specimen from the boys and try to correlate, and you study from the thing that you just dissected. Specimen will be shoot you, prosected. You won't be doing a dissection, but you have to know the location. But tag kore dilo. Then at least you have to memorize and know the relation. Memorize, you have to. But see, once you see the specimen, specimens won't change. The dead body which is left for your examination won't change. So why not see it 1, 2, 3 times and practice? Don't leave the dissection hall. I'm again telling you. Because in the practicals which is to be written in the paper, आप भाइवा में आया तो जो भी बोला ठीक है, देख देख 4 नंबर कम है, 2 नंबर कम है, उसको मैनेज हो जाएगा. But if your script, your OSPRI or whatever it is you are having, or X-ray plate, radiology plate, you have to, once you put it in black and white, wrong answer, then it's wrong. One. At least be associated with the specimen. Now see the carotid pulse. Carotid pulse, the common carotid artery can be palpated against the anterior tubercle of the 6th cervical vertebra called carotid tubercle or caseogenic tubercle. It lies about 4 centimeters above the sternoclavicular joint at the level of the cricoid cartilage. Yeah, this is the cricoid cartilage, the upper border of the thyroid cartilage. This is the hyoid bone. This is the common carotid artery. This is sternocleidomastoid muscle. External carotid artery details. Now, internal carotid artery, again, artery is the main supply of the brain and the eye. See, internal carotid artery is the main supply for brain and eye. Beginning, internal carotid artery arises from the terminal branches of common carotid artery at the level of upper border of lamina of thyroid cartilage, at the level of intervertebral disc between C3 and C4. Now, parts, the internal carotid artery divided into following parts: cervical part, petrous part, cavernous part, cerebral part. That means cervical part lies in the neck. Petrous part, it lies in the petrous temporal bone. Cavernous part lies in the cavernous sinus. Cervical, cerebral part lies in the base of the brain. Termination, the 4th cerebral part of common carotid artery termination by dividing into anterior and middle cerebral artery branches. Cervical part, no branch. Petrous part, corticotympanic branch, pterygoid branch. Cavernous part, cavernous branches, superior, inferior hypophyseal arteries. Cerebral part, ophthalmic artery, anterior choroidal artery, posterior communicating artery, anterior cerebral artery, middle cerebral artery. Now, this is a practice figure for internal carotid artery, right and medial view. Now see the middle, this is the internal carotid artery, cervical part. No branches are here, but the petrous part, it is having a cortico-tympanic branch, carotico-tympanic branch. Okay. Now the cavernous branch here, because this is in blue, which is the cavernous sinus, the cavernous part of the internal carotid artery. The pituitary gland, it supplies the pituitary gland. Superior and inferior hypophyseal artery, superior and inferior hypophyseal artery, that is the pituitary gland. And this is the optic canal, it enters the ophthalmic artery here, and the cerebral part, it is the posterior community artery, anterior choroidal artery, middle cerebral artery, anterior cerebral artery. This forms the circle of Willis. So you just visualize that the artery that is going inside, which have to supply the brain, it has to supply the eyes, the ophthalmic branch. It is going over the petrous part of the temporal bone, the petrous. You just study in this format. Now, this is the short note. Write a short note on subclavian vein. Beginning, the continuation of axillary vein at the outer border of the first rib. Termination, subclavian vein joins the internal jugular vein to the form of brachiocephalic vein in the medial border of the sclerus anterior muscle. Fourth, the subclavian vein extends from outer border of the first rib to the medial border of the sclerus anterior muscle. It arches over the cervical fluid. Relation, anterior clavicle subclavian muscle, posterior sclerus anterior, phrenic nerve, subclavian artery, inferior first rib, cervical pleura, and tributaries, external jugular vein, dorsal scapular vein, thoracic duct of the left side, right lymphatic duct of the right side, occasional tributaries of the anterior jugular vein, vein from the cephalic vein. Now you can see again the subclavian and brachiocephalic veins. These are the branches. This is an important figure. Now, clinical integration, catheterization of the subclavian vein is a percutaneous cannulation of the subclavian vein. It is useful for placement of large catheters in critically ill patients or those who require prolonged intravenous therapy. For this, the subclavian vein can be approached through supraclavicular, infraclavicular approach. Other veins used for central venous catheterization are the internal jugular vein, femoral vein, and axillary vein. Subclavian vein thrombosis. Now, it is a condition where the blood clot forms in the subclavian vein. It may be primary or secondary. Excessive use of the arm in exercise may cause primary thrombosis, whereas amputation, infection, or catheterization may cause secondary thrombosis. Internal jugular vein. Now, it begins as a continuation of sigmoid sinus at the base of the skull at the jugular foramen. Termination, it ends by joining the subclavian vein to form the brachiocephalic vein behind the medial end of the clavicle. Superior bulb, it is a dilatation at the beginning of the internal jugular vein. It lies in the jugular fossa of the temporal bone. And inferior bulb, it is the dilatation near the termination of the internal jugular vein. It lies in the lesser supraclavicular fossa. Larger right internal jugular vein, the right IGV is larger than the left as a direct continuation of the larger right sigmoidal sinus, larger superior sagittal sinus. The left internal jugular vein is a continuation of smaller left sigmoid sinus, smaller inferior sagittal sinus, enclosed with the carotid sheath, carotid arteries, vagus nerve, endorsed with the carotid sheath with thinner around the vein. Lymph node to deep cervical nodes lie along this course. Lymphatic ducts and jugulo-subclavian angle in the left, and thoracic duct opens, whereas in the right lymphatic duct opens. Now you please read it. Internal jugular vein, relations of internal jugular vein. Now This is a practice figure for internal jugular vein. Here the right lymphatic duct, this is the thoracic duct, the right subclavian vein, brachiocephalic veins, this is the and you see the middle thyroid vein, superior thyroid vein, jugular vein, occipital vein, and pharyngeal veins, and the right sigmoid sinus, the inferior petrosal sinus, the left sigmoid. So it is easy to draw the figure. Instead of marking 1, 2, 3, 4, you get lost. So you just draw these figures. Each component, each vessel that is to be learned has to be draw a figure and label it. This is all repetition. Now, cannulation of internal jugular vein. Now, cannulation of internal jugular vein, it can be cannulation through the apex of the lesser supraclavicular triangle and lies between the two heads of the sternocleidomastoids. The needle should be directed backwards and upwards to avoid the puncture of the cervical pleura. If it is punctured, it will lead to pneumothorax. This is important. Thrill can be felt sometimes at the lesser supraclavicular triangle during arterial systole, especially in cases of mitral stenosis. Quicken stent test compression of the internal jugular vein increases the rate of CSF flow during lumbar puncture. Block in the spinal subarachnoid space results in the failure of the increase of CSF flow. Cervical lymphadenopathy and internal jugular vein. Internal jugular vein is a surgical guide for removal of cervical lymph nodes. In malignant tubercular lymphadenopathy, the lymph nodes often adhere to the internal jugular vein and resection of such lymph nodes becomes difficult. It may require removal of segment of the internal jugular vein. So, the importance of the cannulation of the internal jugular vein and the lymphatic lymph nodes in the neck region. So, the important is that when they are dissecting, then you have to be very careful. Now you draw diagrams like this. You just label them and you practice. उसको आप ऐसे ऐसे गुंती करके रटो 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 दिमाग में नहीं रहेगा. So you just draw. You have a big this thing and start labeling them when you are studying. Lymphatic drainage of the head and neck. This is the location of the lymph nodes groups in the region of the head and neck. Now, you draw circle like this, another outer circle. See, this is the stadium, okay, and this is the ground. Now, imagine, now the outer group, occipital node, mastoid, posterior auricular node, superficial parotid, periauricular, submental, submandibular, jugulo-digastric, jugulo-omohyoid. Now, even pharyngeal and pretracheal, paratracheal, retropharyngeal, inner group. Now, this, when I told you earlier, then you can palpate. When I told you all these preauricular, posterior auricular, like this, submental, submandibular. Now, area of drainage of thoracic duct and right lymphatic duct. Area drained by the right lymphatic duct is green. Right of the head and neck, right upper limb, right chest wall, right lung, right half of the heart, and half of liver, right half of the liver. Area drained by the thoracic duct. Okay, this is drained by the thoracic duct. Thoracic duct is the largest lymph trunk of the body. It opens at the junction of the left subclavian and left internal jugular veins. The right lymph trunk opens in the junction of the right subclavian and right internal jugular vein and veins. For details about the thoracic duct, see, you have to read thoracic duct. When you read thorax, you just revise again. And Now, surgical classification of nodes, lymph nodes. Again, you remember the thoracic duct fistula. It is a leakage of lymphatic fluid from the thoracic duct following surgeries of the root of the neck. Obstruction of thoracic duct. The thoracic duct may get obstruction due to infection of microfilaria, Yersinia, Bancrofti. Parasites or by obstruction to the external structures such as malignancy. Surgical classification of cervical nodes. The surgeons classify the cervical nodes into following 7 groups. Surgical connections. Level 1, submental and submandibular nodes. Level 2, this is level 1. And level 2, nodes around the upper part of the internal jugular vein and upper part of the spinal accessory nerve. They include jugulo-digastric nodes. These 2. Now, 3 is the lymph nodes around the middle part of the internal jugular vein. Between the hyoid bone and intermediate, they include jugulo-omohyoid nodes. Level 4 here. Level 4 nodes around the lower part of the internal jugular vein. Between the intermediate tendon of omohyoid and the clavicle, they include supraclavicular nodes. This is clavicle. And level 4. Level 5, nodes of the posterior triangle of the neck along the spinal accessory nerve. This is the posterior triangle. And spinal middle cervical nodes that lie along the midline viscera. They include pretracheal and paratracheal nodes. And more level 7, superior mediastinal nodes. 7 is superior mediastinal nodes. So the location of the, you can draw that figure, plus from your experience on thorax, studying thorax, you can know the surgical classification of the lymph nodes.